so first of all, we are going to palpate the gastrocnemius. We're going to start on the uninjured limb and work towards the pain. So start with light pressure, pads of our, not just the pads, not just the tips of our fingers, but the pads. Start from the origin on the femoral condyle. Work our way down the muscle belly, all the way to the insertion on the calcaneus via that Achilles tendon. And then we'll move to the injured limb, working towards the pain if your pain was down at the distal end of the near the calcaneus. Looking for any tissue change, point tenderness, crepitus, just feeling the overall attitude of the tissue as we work our way down again towards the site of the pain, starting with light pressure, working a little harder. Always compare bilaterally. And then we are going to move on to the tibialis posterior. So again, let's start on that uninjured limb. Origin from the posterior tib and fib. It's hard to find under the gastroc, but as it snakes to the medial side of the leg, you can find the tendon. As it inserts on that navicular, you can have her do the motion of plantar flexion inversion to make sure we're on the right tendon. Find that insertion on the navicular. Again, looking for any tissue change, temperature change, crepitus, anything like that, any tender points. Starting with that light pressure, working towards the hard. You can make sure we're on the right tendon as it goes to the navicular. Identify the coracoid process of the shoulder. So we're going to have our patient sitting up, just in a relaxed position. Fingers in, find the AC joints, and then kind of roll in from there. Should be a little tender, yep, right there. Nice bump right on her anterior shoulder. And then we're going to find the insertion of the rectus femoris muscle. So it comes from the AIIS, travels all the way down her leg, and then inserts over the knee, comes into that patellar tendon, and inserts on the tibial tuberosity. So easiest to have patients sitting like this. You can feel that kind of bony landmark right on that anterior tib. And you can follow it up to the patellar tendon as it goes over the kneecap and then into the quad tendon of the rectus femoris. Now we're going to perform a jostling technique on her hamstring. This is a technique used to lift the tissue away from the bone. It's an invigorating sort of massage used mainly for pre-events. So say we're going to have our patient prone, and then just going to grab some of the muscle belly, lift it up, and shake it around. You can move up the whole muscle belly. I said it should be pretty invigorating because this is used pre-event. This helps wake up the tissue, separate it a little bit from the fascia underneath. Wouldn't want to use this technique on a limb with a history of dislocation. Usually don't use this post-event because it's pretty invigorating, so it can induce some cramping. And then I'll have you flip supine for our next technique. And now we're going to do some supportment cupping on her quadricep. So same concept as the jostling, it's used more as a pre-event to increase blood flow, invigorate the tissue. So just going to have her in a relaxed position. I'm just going to have my hands cupped around her quad, and then we're just going to go up and down. We're going to do that cupping maneuver up and down the muscle belly, like I said, to increase blood flow, invigorate that muscle pre-event. Again, wouldn't want to use it on a post-event or any cramping muscle, wouldn't work the best. Also, try to avoid it on major joints and rib cage, anything like that. It's this technique is mainly used for like thicker, more muscly areas. So now we're going to do a scar mobilization. We're going to say she has a scar over her patellar tendon. So we can start kind of with some broad plane shifting. So just kind of hold it back, feel for any restrictions, see if either way is restricted. So let's say this way is restricted. And you can hold there so you feel it release. You can also, right over the scar, perform some friction massage. So just trying to move that skin over the tendon, over the scar, release the any knots of the fascia that's underneath. Move all the way up the scar. On other areas, it's not so great on the over the knee, but you can do some skin rolling where you just pick up the skin, go right over the scar, try to lift it up. Mainly our goal is to get some more blood flow to the tendon. With friction massage, it's almost like a micro trauma, so that'll increase the blood flow to the scar. And then separate basically the skin from the fascia underneath to avoid any long-term restrictions which might hinder movement later. So just work that scar back and forth. You can also use either the tools or a tongue depressor with some lotion and kind of do J strokes around the tissue, or just straight linear movements. Want to make sure the scar is pretty fully healed, avoid any bleeding. Be careful with areas where the tissue is desensitized from the surgery. And just make sure you get any restrictions out. Work multiple directions, all the way around the scar, throughout the length, and get all the tissue loosened up.